Hello, my name is Dr. Huang, Senior Medical Oncologist from OncoCare Cancer Centre. In this video, I will be sharing with you some information on understanding breast cancer. In Singapore, invasive breast cancer has been consistently ranked as the leading cancer among females over the past 50 years. Fortunately, more than 70% of invasive breast cancers are diagnosed in their early stages, that is stages 1 and 2. The survival of breast cancer depends on the stage at which it is picked up, with higher survival rates the earlier you diagnose it. Although the use of mammography is increasing, a significant proportion of all breast cancers are still diagnosed as a result of symptoms, most often a painless mass. However, some present with breast pain and no lumps felt. Less common symptoms include nipple discharge, nipple erosion or ulceration, diffuse redness of the skin of the breast, enlarged lymph nodes in the armpit area, and less commonly symptoms associated with involvement of other organs due to spread of the cancer. It is good to cultivate a habit of examining your own breast, as it will enhance familiarity with what is normal and enable you to pick up things that feel unusual more easily. If you notice anything different in your breasts, you should seek medical attention as soon as possible. Often, a mammogram and ultrasound will be done. MRI of the breast are used as an adjunct to a mammogram to better assess the extent of breast cancer. A core biopsy is then done to obtain small pieces of tissue to make a diagnosis. So what are the risk factors for breast cancer? It is reassuring that having a risk factor, or even several, does not mean you will get breast cancer. Many women who develop breast cancer do not have significant risk factors. The importance lies in knowing which risk factors we can modify or reduce. The risk factors you cannot change are your gender, age, race, the family history of having relatives with breast cancer or other related cancers, your genetics, the density of your breasts, your personal history of any previous breast conditions which may put you at a higher risk, and the age at which you had your first period or became menopausal. Hormonal factors that increase one's lifetime exposure to the female hormones estrogen and progesterone may increase the risk of hormone receptor positive breast cancer. Apart from previously mentioned factors like early onset of periods and a late onset of menopause, other factors like never having had children or having your first child at a later age, not breastfeeding, or prolonged hormone replacement therapy may also play a role. Breast cancers can occur in the earliest form known as in situ cancers. This means there is presence of abnormal cells inside a milk duct of the breast, but they do not have the ability to spread to other areas. The major invasive tumor types include invasive ductal and lobular cancers, but there are others including mixed ductal lobular, mucinous, tubulary, medullary and papillary carcinomas. Of these, infiltrating ductal carcinoma is by far the most common subtype, accounting for 70 to 80% of all invasive lesions. The biomarkers, namely the estrogen and progesterone receptors and HER2/neu, are checked on all invasive cancers. Hormone receptors are proteins that are present on breast cancer cells by which estrogen and progesterone hormones can attach to and thus fuel cell growth. Cells with excess of the growth-promoting protein HER2/neu, also known as HER2-positive cancers, tend to grow more rapidly and aggressively. The triple-negative breast cancers are negative for both hormone receptors as well as HER2. Hormone receptor-positive breast cancers account for the majority of invasive breast cancers. There are 5 stages for breast cancer, whereby stage 0 refers to ductal carcinoma in situ breast cancers, whereas stage 1 to 4 refers to breast cancers that are invasive and have the ability to spread beyond the breast. The staging is dependent on the tumor size, the axillary or armpit area lymph node involvement, and spread to distant sites beyond the breast. Nowadays, Staging is also determined by other criteria, including the estrogen and progesterone receptor status, HER2 status, and tumor grade, which means how different the cells are to normal ones and how fast they are growing. The conventional treatment pathway is surgery followed by adjuvant therapy, meaning therapy given in the post-surgery setting to reduce the risk of recurrence and improve long-term survival. This treatment comes in the form of chemotherapy, targeted therapy such as trastuzumab, pertuzumab or neratinib, radiotherapy, and endocrine or anti-hormonal therapy, depending on the subtype of breast cancer the patient has. We sometimes give neoadjuvant therapy, which is therapy given in the pre-surgical setting, where the aim is to facilitate either breast conservation or convert an inoperable cancer to one that is operable. This consists similarly of chemotherapy and targeted therapy in certain situations, which may continue after surgery, depending on the clinical picture.